If you find your baby unresponsive and not breathing or not breathing normally, you need to know what to do in order for their best chance of survival. To do this, you need to commence a primary survey to establish that they are not breathing and not breathing normally before starting CPR. Having carried out a primary survey and you have found the baby is not responding and not breathing, there are no signs of life. You must call for help and ask your helper to call 999 or 112 in Europe. Ask them for the ambulance and tell them that the baby is not breathing while you begin CPR. If you are alone, please use the speaker option on your phone so that you can begin CPR as soon as possible. You then call 999 and ask them for the ambulance and tell them that the baby is not breathing. You then must give 5 rescue breaths and observe for recovery. If there is no recovery, you begin CPR at 30 compressions to 2 breaths until help arrives or the baby recovers. If you do not have a speakerphone, you must give 5 breaths and observe for recovery. If there is none, perform CPR for 1 minute, then call 999 and ask for the ambulance and state that the baby is not breathing. You must continue CPR until help arrives or the baby recovers. If you do not have access to a phone, you must give 5 rescue breaths. If no recovery, commence CPR for 1 minute, and then you must take the baby with you to the nearest phone and call 999 and state that the baby is not breathing for the ambulance service. You then continue your CPR until help arrives or the baby recovers. Place the baby on a firm, flat surface and you're going to commence Doctor ABC. D is danger for around the baby and above the baby. R is for response, call the baby's name or flick the bottom of the foot. A, is the airway clear and remove any visible obstructions without doing blind finger sweeps. B, tilt the head back and check for breathing. For 10 seconds, place the hand on the tummy and look, listen and feel for normal, effortless breathing. If they are not breathing, there is no signs of life, you must call 999 and start CPR. So step 1 is rescue breaths. You're going to place one hand on the head and one finger underneath the chin and gently tilt the head back. You're going to seal around the baby's mouth and nose and give 5 gentle breaths for 1 second and monitor that the chest should rise and fall. If no recovery, you commence compressions. Step 2 is chest compressions. Place 2 fingers in the centre of the baby's chest and press down 1/3 of the chest depth and allow it to spring back up. You'll do this for 30 compressions at a rate of 100 to 120 per minute. After your 30 compressions, you'll give 2 breaths and continue this sequence until help arrives or the baby recovers. If the baby recovers, place them into the recovery position. So throughout this process, you must hold the baby's head. We are now going to place them into the recovery position as they have recovered. Hold the head, come in underneath as a support. Bring them towards your body, supporting the head throughout and ensuring that the airway is open and safe, and monitor their breathing throughout this process until help arrives. So in summary, if your baby is not breathing, you must get help, call 999 and get the ambulance and state that the baby is not breathing, and you must commence CPR after your 5 rescue breaths at a rate of 30 compressions to 2 breaths until help arrives or your baby recovers.